Welcome to the presentation on the crucial nexus between women's empowerment and women's health, and how this symbiosis contributes to optimal patient care outcomes. Women's empowerment, it refers to the multifaceted process of enhancing women's ability to make decisions and to take control of their lives, often encompassing education, economic independence, healthcare access, and social support. Empowerment plays a pivotal role in shaping women's health outcomes. Empowered women are more likely to be informed about their health, leading to better decision making regarding healthcare choices. This empowerment fosters a sense of agency, which in turn drives proactive engagement with health related matters. The World Health Organization underscores that empowered women exhibit an enhanced propensity to seek quality healthcare services, thereby significantly bolstering improved health outcomes. So, what are the challenges that we have to women's empowerment and how that can impact women's health? Disparities in accessing healthcare services is fueled by factors like geographical location, socioeconomic status, and cultural norms. Women and children from underserved communities bear a particularly high burden of preventable disease and death. Another challenge is the persistent pay gap that inhibits women's access to quality healthcare. Financial constraints hinder women from seeking timely medical attention and preventative care, which leads to adverse health outcomes. Deep-seated cultural norms and biases often restrict women's autonomy in making health-related decisions. And finally, let's talk a little bit about stigmatization of reproductive health. Reproductive health topics such as menstruation and contraception, it remains stigmatized to this day. This perpetuates misinformation and a lack of awareness. If we're going to focus our talk on maternal mortality rates, is defined as the number of maternal deaths per 100,000 live births from any cause related to or aggravated by pregnancy or its management. We've seen an increase in just 1 year from 20.1 to 23.8 deaths per 100,000 live births within the US. The maternal mortality rate in the US is higher than among any other developed country and varies significantly by race and ethnicity, age, and other factors. So why does maternal mortality occur? What are the causes within the US that's having this rate be the highest amongst all the developed countries? Understanding why is crucial. In the US, some of the primary causes include cardiovascular conditions, infections, hemorrhage, eclampsia and preeclampsia, and complications from anesthesia. Many of these causes that I just listed are preventable and treatable with timely and quality healthcare services. So let's now delve into how race and ethnicity impact maternal health outcomes. Some key factors include racism and discrimination, social and economic factors, and biological and genetic factors. These factors interact in complex ways to produce disparities in our country. This can have a profound impact on maternal health outcomes. Implicit or explicit bias, stereotyping, disrespect, or mistreatment from healthcare providers can negatively affect health and well-being of women. Racialized women may have higher rates of chronic conditions such as hypertension, diabetes, obesity, or sickle cell disease, which can increase the risk of maternal mortality and morbidity. So it's imperative that we address these disparities to improve maternal health outcomes. Initiatives must include comprehensive strategies spanning education, healthcare access, economic empowerment, and gender equality. So I'm going to delve into these factors a little bit more. With regards to healthcare access, ensuring universal access to affordable and quality healthcare services is pivotal. Establishing clinics in rural, underserved areas, introducing mobile healthcare units, and offering financial assistance can bridge the healthcare accessibility gap. Gender equality factors, creating such an environment of gender equality, both socially and economically, This will empower women to advocate for their healthcare needs and the needs of their family. Policies promoting equal pay, safe work environments, gender sensitive healthcare services, and equal representation in decision making bodies are crucial and contribute to equitable health access. Initiatives promoting economic inclusion, like microfinance programs and vocational training, can empower women financially. Financial independence translates to improved access to health services and resources. And finally, comprehensive sex education equips women with the essential knowledge that they need about reproductive health, sexually transmitted diseases, and family planning. This empowers women. And with this empowerment with knowledge, women can make informed healthcare decisions for themselves and for their families. So at this time, we invite you to participate in our first poll. As you think about challenges that we face as an industry regarding women's health, which of the solutions and strategies discussed today do you feel your organization or you as an individual could directly impact? Think about your role as a healthcare leader. Are there actions that you personally could take both short and long term to make a difference? The answer is yes. Each and every one of us can and should be pursuing this as an opportunity to improve our organizations, our communities, and the patients that we collectively serve. Vizient is a company that is committed to supporting women's empowerment. In our recently released Diversity, Equity, and Inclusion report, we shared an increased number of women in the executive ranks, growing from 39.2% in 2020 to 45.2%. And for people of color in executive positions, 11% in 2020 to 15.6% as of December 2022. Innovation, performance improvement, and supply chain solutions are all critical components that support women's empowerment as well. We recognize the vital role women play in healthcare. As you heard Sasha mention, we are prioritizing the development of a comprehensive women's health portfolio in Aptitude, with a goal of connecting healthcare providers to the essential medical supplies and resources needed to support women's health initiatives. Efficient supply chain solutions, strategies, and technology, like the ones here today you're about to learn about, all play a critical role in moving that needle. This is my call to action. I am confident that together we can advocate for changes that make a positive impact. Thank you.